Mainstream media is reporting a so-called mystery virus that has affected nearly 1,000 children in the U.S. in just the past month alone, and they're making it sound pretty scary.
Kids across the country hospitalized after contracting a rare and scary lung virus that starts off like a cold but can turn deadly.
This is such a big deal. Half the beds in the intensive care unit here are full with young people dealing with this mysterious disease.
Well, now to a mysterious respiratory illness that is striking our children in this country.
Enterovirus 68, what the CDC is dubbing as just EV68, is making a legitimate medical concern. But what starts off as a seemingly run-of-the-mill cold quickly evolves into a virus that enters the lungs, causing many kids to nearly suffocate. EV68 is a fast-moving member of the rhinovirus family, aka the common cold. It was first documented in California back in 1962. However, in August, Missouri and Illinois reported an increase in the number of kids admitted to the hospital for this respiratory illness. It has since spread through a dozen states. I just spoke with Jason Tetro, a microbiologist and author of the best-selling book, The Germ Code, to debunk some of the hysteria around EV68. He says EV68 is better aptly described as a rarity than it is a mystery.
Well, this isn't a mystery virus at all. It's known as Enterovirus 68, or EV68 as people are calling it, and it's been around for about 50 years. The difference between what we're seeing today and what we've seen over the last few decades is that normally it was a sporadic virus. It only infected a few people at a time. This time we're seeing a lot more cases. However, there's really nothing, mysterious or surprising about it. When you look at the virus itself, it looks very similar to the common cold virus, like the rhinovirus. The way that it infects is very similar to the flu. The symptoms are almost exactly the same as the flu. And as you might remember, when we had the 2009 flu, people did develop pneumonia and other conditions. And so this is something that would be normal and expected of this particular virus.
This virus only seems so dangerous now because of the number of kids who already have pre-existing conditions like asthma. Those are the ones actually reporting the labored breathing. Mr. Tetro also advised that just like any other virus, the best thing you can do to prevent the spread is by simply reminding your children constantly to wash their hands. In Washington, Manila Chan, RT.